Welcome to another episode of Project Safe, Seniors Against Financial Exploitation. It is estimated that in the United States, some $25 to $30 billion a year is taken from seniors through various scams. This involves seniors over the age of 60 and recent retirees, because sometimes people retire before the age of 60. The purpose of this program is to bring to your attention various avenues that will help you avoid these scams. In North Hempstead alone, there's probably a combination of 70,000 people who are both retired or senior. And it is expected that 10% of them, even though they are cognitively alert, will be scammed during a year. Why? It's unbelievably complex to explain the difference. What we do here on this program is bring to your attention various experts in certain fields that will help you navigate what you need to know to successfully get through whatever it is you particularly are looking for. Today, we're very lucky to have Julie Ward-Abdo with us, who is a healthcare finder specialist, and she's going to help us navigate the Medicare, Medicaid problems that face the country today. Hello, Julie.
Hi, John. How are you today?
Very, very good. And thank you so much for this. I know it's between October 15th and December 7th. People have to do something with their Medicare, but I'm really not sure what they have to do. And that's why we have you on the program today, to guide our seniors in what they should be doing, the pitfalls to avoid, and what to expect.
Okay.
I know Peter was asking just before I did this again. I did this a couple of different programs. I'm John Ryan, and my partner Peter Janowsky are the co-hosts of this program. And oftentimes I forget to say that because it's really insignificant. You're the most important part of this show. As we were beginning the show, Peter wanted to know the difference between Medicare and Medicaid. That's going to be the first question we ask after you explain how you got involved in this field.
Okay. Well, I started out in the Medicare field in 2010, and I had been doing insurance prior to that. I came across a niche that I enjoyed, that I was very comfortable with, that I felt I could help people. And the more I became involved in the Medicare field, it became the total portion of my business. I gave up the other parts of the insurance industry that I had been involved with, because this was a growing business and I saw a great need, because many people were confused. There's a lot of confusion with Medicare. When do I take it? How do I get onto it? What does it do for me? And at that point in time, I decided that I would be an advocate for the seniors to help them find plans, transition, go forward, and get the best coverage for them.
That's very important, because actually Peter and I are financial advisors, and that type of question gets posed to us all the time, and we don't have the expertise to answer it, and we wouldn't answer it.
Exactly.
But now I know Peter had questions.
It can get very, very complex. I know you're going to get into all the parts, the alphabet parts of the Medicare, but very basically, if someone's tuning in and watching this and they're saying, well, Medicare, isn't that like Medicaid? What would you say?
Absolutely not. They are two totally different pieces of the puzzle. Medicare is for anybody 65 and older who has worked and paid into the system for 40 quarters or 10 years, or have been on Social Security disability for 24 months at any age. Medicaid is really income related. So it's for people that have very low income.
Any age.
Any age.
Right. And
at that point in time, when people that are on Medicaid, where they collect Social Security and they make below $850 a month as a single person, they're eligible for Medicaid, but then when they become Medicare eligible, they have Medicare and Medicaid. But most people above that financial criteria has Medicare.
Medicare requires 10 years of work.
Absolutely.
I didn't know that.
Yeah, right.
Yes, you have to work, like I said, 40 quarters or 10 years. They don't have to be consecutive. It's through your lifetime. Because Medicare Part A, which is for hospitalization, is free if you've worked 40 quarters. Medicare Part B, which is doctors, anything that happens outside of the hospitalization or hospital, you have to pay for. And people are very stunned when they find out that I have to pay for Medicare. Yes, Part B Medicare you have to pay for.
That's where people get a supplemental, am I right?
Well, Part B is for anything outside of doctors, tests, anything outside of a hospital setting. That, right now, if a single person makes $85,000 a year or less, or a married couple makes $170,000 a year or less, they pay $134 a month for Medicare Part B per person.
And that covers what? Everything?
No, Medicare Part A is hospitalation.
Only. That's the
Only.
hospital stay.
Whatever
1
happens
week, 2 weeks,
inside
5
of
weeks.
the hospital.
Okay.
Exactly. Now, with Medicare Part A, if you go into the hospital, there's a deductible. It's $1,340 per benefit period. It's not an annual deductible. It's a benefit period deductible. What happens if you've come out of the hospital, you've been out of the hospital for 60 days, and you go back into the hospital,
deductible.
you're going to have the exposure of $1,340.
Okay.
That's why people with Medicare have to find a supplement or a Medicare Advantage plan, because Medicare doesn't set a maximum out of pocket. So you can incur high, hospital
in and out,
deductibles.
absolutely. Right.
And when you go to the doctor, if you're on straight Medicare, there's which is Part B Medicare,
Okay.
there's an annual deductible of $183. So the first time you go to a doctor, you're spending $183 if that's all you have. What happens after that, you're paying 20% of the rest of your bills. So if you go for an MRI, if you go for blood test, if you go to whatever, you're paying 20% of the bill. Now, it doesn't sound like a lot of
And you're not
money,
right. That's also-
it can be a lot.
but it can be a lot.
can
That's
be a
also
lot
a
of
doctor visit, too.
Absolutely.
Every visit.
Everything.
Okay.
So what people do is they supplement it, or they go on a Medicare Advantage plan because it cuts the costs, and you know that you're going to have maximum out of pocket on a Medicare Advantage
Right.
plan, or a supplement plan is going to pay for parts of, if not all of, what you're exposed to after Medicare.
Wow.
Now, once you have Medicare, the other thing you have to have, if some people say, I just want Medicare, I'm going to have Part A, Part B, you must take a prescription drug plan. If you don't take a prescription drug plan within the first 63 days of going on to Medicare, you will
Medicare B.
incur A and B.
Okay.
Okay. You will incur a penalty, which is 1% of the national average for every month that you don't have a prescription drug plan. A lot of people don't realize that, because they think, I have Medicare, I don't need a prescription drug plan. Or I have clients that say to me, I don't take any prescription drugs. It doesn't matter.
Wow.
The Medicare ruling is you have to have A, B, and D. That's the minimal amount of what we call original Medicare.
And we didn't talk about D yet.
Right. D is prescription drugs.
I thought that was the C part.
No, C is
Okay.
Medicare Advantage.
Okay.
So Medicare Advantage came onto the marketplace in 2007.
Let me just interrupt for 1 second.
Absolutely.
This is a half-hour program.
Right.
This topic is probably a weekend.
Yeah.
All right, so we're going to make it
Hopefully people are
really
taking notes.
concise.
We're watching over and over.
It's amazing.
Right.
It's
Really
amazing.
we'll make it as concise
Yeah,
as
'cause
possible.
if you-
How's that? Okay, so what happened in 2007, because there are a lot of people that couldn't really afford the bills, they couldn't afford a supplement plan, because supplements tend to be more costly. George Bush reformed Medicare, and Medicare Advantage plans became important to the marketplace. Medicare Advantage plans are through private insurance carriers, and they cover A, B, and D. So if you think about it, hospitals, doctors, and prescription drugs are all embedded in one plan. And people can relate to it, because when you're on group health insurance, what do you have? You have a plan that
Right.
includes doctors, hospitals, and prescription drugs. So it followed that pattern. Now, with Medicare Advantage plans, you have to evaluate them on an annual basis, because things change. Carriers come on the marketplace, come off the marketplace.
So C is almost a gap insurance then? Or am I getting that wrong?
No, it
The
is
advantage
it's in lieu of that.
In lieu,
because
okay.
a Medigap is if you have original Medicare
Right.
with a prescription drug plan, you get what's called a supplement plan or a Medicare Medigap plan. And what happens is a supplement fills the gaps that Medicare doesn't. So if you only have Medicare, you want to be protected if you go to the hospital, if you go to the doctor. So you would use Medicare primary,
Okay.
and then the supplement would pay some, if not all, of the costs that Medicare doesn't pay.
Like the 20%.
Exactly.
Right.
And the good thing about a Medicare supplement plan, if you have straight Medicare as your primary, You can go to any doctor, any hospital, anywhere in the entire country that accepts Medicare. There's no network. The network is Medicare.
Okay.
So if Medicare submits the bill and Medicare covers the bill because the doctor takes Medicare, the supplement plan will pay its portion of what Medicare doesn't pay.
Okay.
Okay? Now, Medicare supplement plans are standardized plans. What that means is that it does not matter the carrier. They are lettered, so you can have a Plan F. I'm sure everybody's heard of Plan F. There's a Plan G, there's a Plan N, there's 10 different supplement plans. What happens is it doesn't matter the carrier. All the benefits are exactly the same because they're standardized. So when you're looking for a Medicare supplement plan or Medigap plan, what you're really looking for is the premium, because the premiums vary by carrier. So obviously, if all the
Every service will be the same? It's just the premium?
The premium is the only difference. If you have a Plan F, all Plan F, doesn't matter if it's from United Healthcare, it's from Empire, it's from Mutual of Omaha, it's from Aetna, it doesn't matter. They cover the same things.
About how many carriers are there?
Well, in New York, I mean, there's quite a few carriers. I can't really name them all, obviously, right now.
I mean, it's like,
But what happens in the state of New York, there was always one carrier that really, capitalized on the marketplace because they had the lowest premium.
Right.
And that was AARP United Healthcare, and I'm sure everybody knows.
I've heard it, yeah, absolutely.
You've seen commercials on TV all the time. In July, Empire came on the marketplace and offered them a little competitively. So what happens is there are carriers on the marketplace, but you don't hear about them because the rates are not competitive.
Right.
So now there's competition. Empire and United Healthcare are competitive rate-wise. So now people have something else to look at. Okay, they have a choice.
I'm very confused. If they're offering the same services, why would anybody go with a higher premium?
They don't. That's why when I say nobody really went in New York. Nobody really went with anybody other than United Healthcare.
Right.
Now, this past July, Empire came on the marketplace.
So it's worth looking at.
They're competitive.
Right.
The rates are competitive. So now, again, people are looking at the different carriers because they feel they have a choice.
But the services and benefits are the same despite the premium.
Right.
That's amazing.
Exactly. Okay, so that's what now, once you have a supplement plan, you're not really affected by the annual enrollment period, which is the period that we're entering right now, okay? What is affected in the annual enrollment period is the prescription drug plans and Medicare Advantage plans. Carriers change their formularies on drug plans.
Annually, right?
They can really change it at will, which people don't really understand, and it's a little confusing. They can change them at will, but if that happens, there's ways that people that are on the drugs that may have come off the formulary during the course of the year can still get their drugs on that formulary, because there's exceptions.
Just take a second to explain that.
Okay,
if
so
they change it, a drug in the middle of the year, a very expensive copay drug, could be dropped.
Well, yes, for any new people going on to the plan. Remember, people are going on these plans on a monthly basis if they're new to Medicare. Because, if you're on Medicare and you're on a plan and your drug is dropped, your doctor sends the drug company an exception. And what happens is that drug will remain on the formulary for you for the year.
Through the end of the term.
Because you can't change your plan midstream.
Oh, but you will be covered.
You will be covered.
With
it's
the
not
doctors.
like
I thought you got dropped.
No. You don't get dropped. They don't do that. But anybody entering the plan that's new, they won't have that drug covered if it falls off the formulary. Okay. It's not something that happens a lot, but it does happen occasionally.
Okay.
Okay. So what happens during this time period? October 1st, all the new plans are announced for the following year. What that means is you check your drugs to make sure the drugs are still on the formulary, because if they're not and you stay on the plan, they're not going to cover you. So you check the drugs to make sure they're still on the formulary. If you have a Medicare Advantage plan, what you have to do is you have to see what the new co-pays are for doctors, hospitals, if there's any new benefits, if any benefits have come off the plan. Some plans actually leave the marketplace. There are plans that were on the marketplace for 1 year, and during the AEP season, for some reason, they come off the marketplace. Medicare Advantage plans are county specific. So here in Nassau County, we may have a plan that has the same name as someone in Suffolk County or in Queens County, but the premium could be different. Some of the benefits could be a little bit different. So it's very important when I work with people and they say, well, my friend has da-da-da-da, and I go, where does your friend live? And they tell me, I'm like,
that's a tremendous point. I think nobody would ever consider that it changes county by county. How does that work?
Changes
How does that
county by
happen?
county.
That's because it's under the state. Right? I mean, state insurance is governed by the state. So,
right, and so what happens is
there
like Nassau County, I mean, you may have the same plan in Nassau County and Suffolk County and Queens County, but not always. You have to know what's going on. That's where people like me come into play, because I help people navigate the system.
Right. No, this is not something, and we've gone through this, Julie and myself, at different times, and with clients, we've gone through this.
Right.
It's just too much to navigate.
very
You have a
confusing.
senior sitting at home who is not computer literate. They're
Exactly.
75 years old, and you know what drug is being dropped from next year's program already.
Right.
They don't. And they've been happy for the last 3 years, and they're going to have an exception. Why?
Just to know that you have to go through this annually it's almost like change. You have to do this almost like you change the batteries in your smoke detector. You have to be ready to do it.
Yes.
I got a couple of questions.
Go ahead.
Part B
Yes.
covers doctor's visits.
Correct.
Does that include dental, optical, or chiropractic, anything like that?
Dental and optical are not, as far as,
Ophthalmologist.
yeah, as long as it's a doctor, yes, it's
Right.
covered.
But
okay?
eyeglasses, things like corrective
Eyeglasses
vision.
are not covered,
Right.
no. Dental is not covered on Medicare.
At all.
No, And a lot of people want to know what's the best dental plan.
Doesn't exist.
Yeah.
Right.
I'm sorry.
We're not going there.
I would love for there to be a great dental plan, because believe me, I can sign up a lot of people right now
Oh,
because
sure.
that's what they're looking for.
Of course.
But now with Medicare Advantage plans, some Medicare Advantage plans have dental, or you could buy dental for a little extra premium every month. They also have, some have benefits like hearing aids. So when you look
Advantage
at
is C.
C.
Right,
So
right.
Medicare Advantage plans are really a good option for a lot of seniors because they're relatively inexpensive. They have zero premium Medicare Advantage plans out there.
Now, getting to how you work with your clients, I'd like to, if you could say how does someone find you? What is the process? Do you ever do side-by-side comparisons where you say, you know what, Advantage is good, Advantage is not bad? How do you get compensated?
Okay.
I'm sure they'll ask anyway.
The
Okay.
compensation one is very important. We're going to
Okay,
touch
we'll
on that
start.
because
All right,
that's where a
let's start
scam
with
comes
that.
in.
Okay,
Right.
for compensation, I do not get compensated by the client. If you work with Medicare clients and Medicare plans, you cannot accept money from a client. It's against the rules and the laws. So what happens is I get compensated by the carriers. Every year I have to credential, I have to test, I have to make sure I know all the new rules and regulations. So once that's done and I credential with the carriers, Medicare sets what the compensation is.
Okay.
So therefore, it's a very even playing field. The carriers compensate the same amount of money. So
You're not pushing me to an...
Exactly. Now, I wouldn't do that, but there were plenty of
No,
people
100%.
that
That's the
believe they
scam,
would.
too.
I've seen
All of a sudden, everybody's going to be
people-
loading up with one insurance company because they're
Exactly.
paying $500 versus $200.
Exactly.
It's a disgrace.
But that doesn't happen.
Right.
So what happens, how do people find me? I do a lot of education. So when I do adult education classes in the evening in many schools on Long Island, I do many, many seminars. I do things like this. I get invited to speak. And again, it's through word of mouth, through my website. I have a business. People hear about. I work with elder care attorneys. I work with financial planners. I work with a lot of people that come in contact with seniors.
Right.
And once they're comfortable with my services because they're happy
Right,
that I provide the service and they get good feedback, then more and more it's word of mouth. I also work with group insurance. So for instance, if a company has group insurance, I can go in with the HR person, give a seminar so people that are retiring or possibly thinking that they'd rather have Medicare than their group plans, I work with them.
Okay. The thing is, and I'm stressing this, and that's why Julie's on the show, is the amount of people that do not pay attention, a lot of attention to this. It's just like, oh yeah, just sign the papers. I mean, this is such a confusing thing, yet it's so important because There's certain drugs that are $500 copays. That's, you know, the people are taking.
There's some that are more than that.
100%. And to know it could be covered by company A and not by company B, but you just signed the form, and every
Sean,
year just repeat it.
You know what? I can tell you a story.
Go ahead.
Okay.
Stories are the best.
Okay. All right. So recently, I worked with a couple back in the summer.
Okay.
He was a professor for many, many years. So what happened was he got my name through his financial advisor. He called me. We were back and forth, figuring out what he wanted to do, and I go to his house. He invites me to his house to sit down because he felt more comfortable there. I said, fine. So I went to his house, and I walk in, and he said to me, first of all, once you're turning 65, you get a stack of papers like this from everybody under the sun who wants your attention. So I walk in the house, and he says to me, Julie, you know, I had somebody here last week. I said, oh, okay. He said, and I want to show you something. So he had a package of papers that another agent had come in and signed and had him sign. The only thing he didn't do was date them, and he decided not to give them to the agent until he saw me.
Okay.
Because he found out about me right after that. They were putting him on an HMO plan that had none of his doctors in the network, and he didn't even know it was an HMO. He didn't want to be on the plan. If he had given those papers over to the agent and the agent processed the papers, he would have been stuck until this time period where he could have made a change.
Right, that's the issue.
But that's what happens.
Yeah, this is a tough question. Was that person going to be compensated any differently because it was from an HMO?
Well, yes. I mean, there's different compensations from different plans, yes. But HMOs, Medicare Advantage plan, I wound up putting him on original Medicare with a supplement and a prescription drug plan because he and his wife were going to spend time in California, and he wanted the plan. An HMO would never work in California except in a case of an emergency.
Right.
Okay.
Plus, in New York, his doctors weren't on the plan.
That's a great question, because before you said it goes county by county, but how portable are these plans? Because a lot of people do move in the middle of the year, or they'll have places in the south and
Right,
go back and forth
even for a couple of months.
So what happens is, if you have a PPO, which means you have in and out of network benefits on a Medicare Advantage plan. If you go to another state, even for a period of time, you can go to a doctor there because you have out-of-network benefits.
Right.
If you have a Medicare and a supplement plan, any doctor, any hospital, anywhere in the entire country that accepts Medicare, so you're okay. If you have an HMO, you're only covered in case of an emergency. So if you feel your life is really threatened, what happens, you can go to an emergency room, or you can go to an urgent care center, which I call those doc in the boxes that are all over the place now. You can go to those and be treated. But other than that, you can't say, well, you know, I feel like going to a cardiologist today because, you know, I feel palpitations. You'd have to pay out of pocket.
Typical HMO situation.
Right, exactly.
Okay. I just want to go back to that situation with the fella who you...
Okay.
And there's two things that happen there that I just like to bring to... One, it's a scam and it's a disgrace. Or two, you can have a person who really doesn't know that much, and they're new on the job. They think. So you have to give somebody the benefit of the doubt. He thinks he's doing a great job for the guy. And that's why Peter and I, we're financial advisors, we believe so strongly in the referral system. If somebody comes to me for those questions, I would refer them to Julie, because I don't want to get in the middle of something I don't understand. And unfortunately, you have people who get a job and they don't understand it. Right.
And in addition to that, there are agents out there that are only certified with 1 or 2 carriers. So,
oh, really?
Right. There's a lot of work to be certified by the other carriers because, again, in the month of July and August, I'm testing, I'm studying.
You're getting certified by the carriers. Do you have to have any certifications or license by the state?
Absolutely.
And what is that?
I have a life, health, and
oh, like us. Okay. Same license.
Okay. Same license. Yes. Okay. So I have to have that license, and you
every 2 years.
Every 2 years. Right. But also they have where you have to take Medicare testing. So I have to know the Medicare rules and regulations. You have to pass that test with 90 and above annually. So there's a lot.
I agree.
Yeah. There's
but
a lot
that's
of
the person
testing,
you want.
So, right. That's
this is the person's health for the next year. You don't want somebody who's like, well, what am I going to do this weekend? Well, I'll sell some Medicare gap insurance or whatever. It's you want a person who knows what they're doing.
Exactly. So that's why people refer business to me.
Right, it's important. One of the other questions, just putting it together quickly, because we're basically running out of time. There are computer programs, I was told, for D.
Well, what you can do is you can go on Medicare.gov, and you can put your drugs in, and then you can see what the different plans, how they cover it. What happens is it's a little complicated,
Okay.
it's a little confusing. I do all of that. I have programs where I can go in and I find out the drugs, how they're covered, what the co-pays are, what drugstores you can get better pricing than other drugstores. So I fine-tune all of that.
Wow, okay,
So when I
okay.
sit down with you, you know how much you're paying for everything. And I give you the options. You can go this direction, you can go that direction. What's more comfortable for you?
Okay. And the thing is, I think the most important thing that we're trying to remember here is you get paid by the carrier. You're not getting
Yes.
anything from me.
No.
And obviously, during the course of the year, if I go for drugs and I find out that half of them aren't on it, you lose the following year. I'll say, well, Judy didn't set me in the right direction, which is not going to happen.
That's not going to happen. But what happens is people will call me if they come. People have access to me all year round. So if something comes up and they're confused or they need a little assistance,
Okay.
I tell them how to get through it so they're comfortable. And I reach out to my clients twice a year, even if I don't hear from them. I do a mid-year review. I send them a letter,
Wow.
hey, what's going on? Let me know what's happening, so I can prepare for this time period, again, between October 15th and December 7th.
Every year.
They can make their changes for the following year. And then at the end of September, I send a letter out, tell them, call me. We need to discuss. Even if there's no change in their plan and they're not going to do anything, I tell them, call me. I get very busy at this time of year and I don't want to miss anybody. So they call me and I just review. I talk to them on the phone. Okay, so this is what we have.
Right.
Are you happy? Do you want? And it's a good touch base every year, so they're comfortable going into the following year.
You're holding hands the proper way.
Yes.
Yeah, that's monitoring someone's account properly.
I just have one last quick question
Yeah,
before
okay.
we have to
We're running
close.
out of time.
Is in the middle of the year, okay, I've already
Right.
did my plans, and now I have to go on a very expensive drug, which is not covered on the one I picked, which was perfect for me this year.
Right.
That's a good question.
What are my options?
What your option is, if you've tried, if you have a doctor and he's
Right.
tried 2 other drugs that don't work for you, he has to send an exception to the carrier, and they will put that drug on the formulary for you.
I get it. Okay.
And then you can even ask them to re-tier it, because even if it's a little bit more expensive than you want, you can re-tier it, and oftentimes they'll do that. They will.
Perfect.
They work with you.
Okay,
They work
that's
with you.
the
You just
main
have to know what to do.
Right,
Most
right,
of
which
them
is-
don't. They call me.
That's fine. That's your purpose.
Right,
Okay,
exactly.
to send the
That's
senior in the
why-
right direction.
That's why I do it, because it's very gratifying to help people.
Great.
All right, we're winding down.
Okay.
So once again, I'm Peter Janowsky, and this is John Ryan, and we want to thank you for watching, but most of all, we want to thank Julie Ward-Abdo, who is a senior health plan finder, and we are Project Safe, Seniors Against Financial Exploitation, and the object of Project Safe is to help seniors and their adult children, retirees, just about everybody that fits that age, safeguard themselves against financial exploitation and scams. If anybody would like us to come out and give a presentation at their church or synagogue, any civic association, any friends group, just give us a call at 516-719-6396. And thanks for watching.